Mary Fetchett, and I'm founding director of Voices of September 11. On behalf of my husband Frank, who's sitting in the front row here, and the Voices team, certainly our staff and our volunteers who are with us every year, I want to welcome you to our 11th annual information forum. Today's agenda is built upon, as it always has been, the evolving needs of the 9/11 community. And I've always felt strongly that 9/11 affected more than the families, but also the rescue and recovery workers that are now facing medical and psychological problems and death. And of course, the over 500,000 people in Lower Manhattan that either lived, worked, went to school, or happened to be in the area on 9/11, the survivor community. We're honored to have the president of the 9/11 Memorial, Joe Daniels, here. And the museum director, Alice Greenwald. And we want to thank them for the opportunity to offer a preview of what will be the 9/11 Museum exhibit representing the victims that died that day. On September 11th, my husband and I lost our 24-year-old son, Brad. He worked on the 89th floor of Tower 2, and he worked for KBW, Keith Breton Woods. And as a mother, and I was a clinical social worker at the time, I saw a real need to form an organization that would provide information and support services to all those that were affected on 9/11. And so along with Beverly Eckert, who lived in an adjoining community, we co-founded Voices of September 11. We work with other 9/11 families, many who I see in the crowd here today, and I won't go through mentioning all of your names, but we wanted to make sure that, number one, this didn't happen again, so we pushed for the creation of the 9/11 Commission, and we wanted to ensure that an appropriate memorial was built on the site where our loved ones died, to honor their lives and tell the story for future generations. And we believe the magnificent memorial that opened last year accomplished just that. It's a place for our families and those that loved the people that died that day to go and reflect and remember. Monica Eichen, who ran September's mission, had the idea of creating what she called a time capsule to honor the lives that were lost that day. So in 2006, Voices of September 11 launched the 9/11 Living Memorial Project to do just that, to honor the lives that were lost by sharing photographs and personal keepsakes. Our social work staff, who had established relationships with the families at the time, have met with over 1,600 families, sometimes multiple times. And they've brought, they might bring 5 photographs, they might bring 500 photographs and personal keepsakes that we scan and help them organize. This is a very emotional but therapeutic process for the families in documenting the lives that were lost in a meaningful way, so future generations will always remember. The Living Memorial Project has led us to our important partnership with 9/11 Memorial Museum. To date, we have collected over 70,000 digital images, which will become a core component of the 9/11 Memorial exhibit. Our work continues, and we're very proud of our contribution of what will one day be a magnificent museum. So with that, it's my privilege and honor to introduce the president of the 9/11 Memorial Museum, Joe Daniels.
you all for coming today. It's a real pleasure to be here at Voice's 11th Annual Day of Remembrance. And I want to, of course, thank Mary and Frank and all the staff at Voices for all their work behind what is such an important service to the 9/11 community. I'd also like to acknowledge a couple of the 9/11 Memorial Board members who are here. All of them are 9/11 family members who have contributed so much to this project from the very beginning. Antiola Casamatides and Paula Berry.
And share it with others, because knowledge is power. And you can be helping the 9/11 community by disseminating that information in a positive way. Thank you and God bless you.
Hi, good afternoon. First, I want to say thank you to John for the message that he provided before my presentation. It's always good to hear his voice when he is giving us direction and giving us feedback from the 9/11 community, and when he's able to provide us feedback on what's going on in the community, and that's appreciated at NYOSH. I also want to thank Mary and Frank for inviting me here today. I really appreciate the opportunity to speak about the World Trade Center Health Program and clarify any misinformation that may be out there about the program, and I always appreciate the opportunity to encourage people to apply if they're eligible. As Mary introduced, my name is Laurie Breyer. I work for the National Institute for Occupational Safety and Health, or NYOSH, and NYOSH is an institute within the Centers for Disease Control and Prevention. NYOSH is tasked with administering the World Trade Center Health Program, which is created under the James Zadroga Health and Compensation Act. I want to be clear that the health program really administers the medical monitoring and treatment portion of the Act, meaning that we work with the clinical centers of excellence to provide healthcare treatment to responders and survivors. And in a minute, I'll provide some more information about what the term survivors means. The healthcare program is separate from the Victims Compensation Fund. Well, there'll be a panel discussion after this one, which will discuss more about the VCF. And it's also separate from the WTC Health Registry. The Health Registry collects data and analyzes information from individuals in their cohort. They do not provide medical monitoring or treatment. So there's very distinct entities in this program. You have the World Trade Center Health Program, administered by NYOSH, medical monitoring treatment. Victims Compensation Fund provides compensation to individuals who are eligible to apply. And then you have the WTC Health Registry, which collects data and analyzes information. So I think that it's easy to confuse the three because we all work with the same population of individuals, but we all have three distinct entities in the care of World Trade Center responders and survivors. The act was signed by President Obama on January 2nd, and the new program opened on July 1st, 2011. We have 7 clinical centers of excellence with multiple locations across the New York area. I have a handout that I'll put on the World Trade Center Health Program table after this presentation if you'd like to pick one up. It lists all of the 7 clinical centers of excellence as well as all the multiple locations in the area. We also have a national program, and the national program serves responders who have moved outside of the New York City area, or they responded from outside of the New York City area during the 9/11 events. And so the national program has clinics all over the United States. Currently, there are a list of covered conditions in the Zadroga Act that includes airway and digestive disorders, mental health conditions, and musculoskeletal disorders for responders. And again, in the handout that I'm going to have on the table in the back, it lists all of those specifically. There are other conditions that are covered under the health program that are a result of disease progression or complication from one of the covered conditions in the law. As many of you know, there was a petition filed with NYOSH to add a list of covered conditions to the Zadroga Act. On June 13th, the administrator, Dr. John Howard, issued a proposed rule to add a certain list of cancers to the list of covered conditions under the World Trade Center Health Program. That was open for 30 days and it closed on July 13th. The administrator is in the process of finalizing his review of the comments that have been received, and we hope to announce a final decision shortly. The list of cancers that have been proposed are also in my handout, which will be on the back table at the end of this presentation. Lastly, just to give you a brief idea of the enrollment, the progress in enrollment into the program, the health program. There were 61,798 members enrolled prior to the new program. As John was mentioning, there was a program, the Medical Monitoring and Treatment Program, that was ongoing prior to the Zadroga Act, and that included the Clinical Centers of Excellence that treated responders, as well as the New York City Health and Hospitals Corporation Environmental Health Center that treated survivors. And so before the program began, we had 55,910 responders and 5,888 survivors. Since the Zadroga Act became effective on July 1st, 2011, we've enrolled 1,384 new members, 771 responders, and 613 of those are survivors. We receive on average about 140 applications for enrollment into the healthcare program a month. It's approximately 76 responders a month and approximately 67 applications from survivors a month. And as I mentioned, the term survivors can be confusing, but basically that covers anybody who was affected on 9/11. I'll give you some clear definition. We try to explain it as medical monitoring treatment service for responders, workers, volunteers, and adults and children who are residents, area workers, students, and passersby most directly affected by the 9/11 attacks. And so I just wanted to provide a little clarification on that because I think that may cause some confusion in the community as well. And lastly, I just want to say that if you think that you may be eligible or you know somebody who may be eligible to receive healthcare treatment or monitoring, please stop by the table outside the door and we'll be happy to give you more information on how you can apply. Thank you.
Like rhinitis or inflammation of the nose, sinusitis or inflammation of the sinuses, lower airway diseases like asthma or COPD or emphysema, gastrointestinal disorders like acid reflux, musculoskeletal injuries, mental health conditions like post-traumatic stress disorder, depression, panic disorder, anxiety, again, soon to be cancer. But we also know that there's a lot that we don't know. That the variety of exposures, the mix of exposures that were present at 9/11 was unprecedented, at least in this country. And that there's still a great deal we have to learn. And by responders participating in a monitoring exam and sharing that information with us, again, we're able to learn more, to look more systematically at the health conditions that are being identified by responders and ask questions, like the questions we asked about cancer. Could this be a related condition? And then those folks that work with me in the data center and at the clinical centers who are researchers and scientists and epidemiologists can then do the science, if you will, to verify that these conditions are in fact related so that you can be treated for them. Which leads me to the treatment portion of the program. If in the monitoring exam, the physician that is evaluating you thinks that you might have any type of health condition that's World Trade Center related, whether that's mental health, physical health, or both, then you can be treated in the program as well, free of charge for responders. That means medications, hospitalizations, surgery, physician visits, specialty consults, anything and everything that you might need to treat those World Trade Center related conditions is covered by the program at no expense to you. In addition, there are experts on staff who know the ins and outs of systems like workers' compensation, the September 11th Victims Compensation Fund, line of duty injury, 3/4 disability pensions and other disability packages that you might have available to you through your union or employer, etc., that can sit with you and walk you through the process for applying for those programs, advocate for you along the way, and help you to get the benefits that you were entitled to. Especially because sometimes access to those benefits is exactly what you need in order to protect your family in the future, especially if you're ill and unable to work. Finally, I just want to say a word about mental health treatment. Also available in our program to all responders, again, completely free of charge and absolutely positively confidentially. That means that you can come to our program and receive the care that you need for anxiety, for depression, if you're having nightmares and trouble sleeping, if you simply don't feel like yourself, or you're having difficulty with your relationships, or your wife tells you you're more irritable than usual, whatever it might be. The program is equipped and staffed with experts to help you with those conditions and treat them either through individual counseling sessions or group therapy, again at no charge and completely confidentially. I've been working in the program now for about 10 years. been working with World Trade Center responders, I've had many, many, many World Trade Center responders say to me that they feel like they are the only one now 11 years post 9/11 that still can't get over it, if you will, or that feels sad, or that feels more irritable than usual, or is having trouble with drinking or with drugs. My response to that is always, if you were not having feelings like that, I would think you were abnormal, right? It's absolutely, positively the experience of most people that come into the program, and we are equipped and prepared to help you with those conditions as needed. So again, I just sort of wanted to give you a general overview. I want to pass the mic now to Terry Miles, who is the Executive Director of the World Trade Center Environmental Health Center Survivors Program, and I'm happy to take questions afterwards if helpful. Thank you.
Scotty did a wonderful job talking about the treatment and care that's rendered in the responder program. And everything she said about that component is true for the survivor program too, with one exception. Legislatively, there are some distinctions between how the responder program and the survivor programs are operated. But again, a quick reminder of those distinctions. There's absolute definitions legislatively as to who belongs into which program. And the program that I oversee is for the survivors. And as was previously said, that's for people who were living in the community. And legislatively now that's been defined as south of Houston Street. People who are working in that same geographic area. People who are going to school then, and that means preschool, daycare, people who are in college level. And it includes people who are passing by the hub that is the people who commute through this area and was caught in the cloud on after 9/11. That's the community of people that we serve in our survivor program. Legislatively, this program is not considered free, unlike what is true for the responder program. Legislatively, if anyone has insurance, then we are obligated to bill that insurance. But there's to be no out-of-pocket costs to anyone getting care, meaning co-pays and deductibles is covered by the government. And so if you have insurance or you don't have insurance, it doesn't matter. You're welcome and we want you to come into the program. But each person has gone through the financial counseling on a very individual level so that everyone can fully understand, if you have insurance, how that insurance will be billed. If you don't, how the program will be billed. Again, I want to emphasize, at no out-of-pocket cost to you. Also, legislatively, Scotty talked about the monitoring component of the responder program. It is a requirement that someone be sick in order to come into our program. So we don't have that monitoring piece the way it's defined for the responder program. We do have a monitoring component, but that means after someone has come in and they've gone through their initial assessment and we realize that they do have a certified condition for which they can be treated, again, legislatively, and then that care is rendered. And then once a year, we ask everyone to come back to be monitored so we can assess where they are with their health status at that time. But certainly, as care is being rendered, people come as they need to. So people in mental health care that Scotty talked about so beautifully, most people in mental health care come in at least once a week, sometimes more often. People with physical needs, we come in monthly, every 3 months. It just depends. You know, it's, you're getting care at individual physicians. It's a similar setting. However, what makes us different and distinct, and I'm often asked this question, if I have insurance and you're going to bill my insurance anyway, then why should I come? It's because we have a level of expertise that most physicians and providers of health care simply do not have. And that's not to their fault at all. Physicians in the community don't know what they don't know. And just as Scotty was saying, encouraging people to come into the monitoring part of the responder program, it's by taking care of people who are sick from 9/11 related exposure that we have developed an expertise. That's why the legislation specifically calls for clinical centers of excellence. Because that's who we are, that's what we do. So just as Scotty was making a plea for if you have an illness or not, for the responders to come in, I would say similarly, if you or anyone you know of has had a health change after 9/11, and they were in that geographic exposure area, which also includes the very northwest tip of Brooklyn, by the way, then I would encourage you to seek out enrollment into the healthcare program. Scotty did a great job of going through certified conditions. That can be confusing sometimes to people because they think they already have to have a diagnosis, but that's not true. As Scotty was ending, what for our program, someone has to have a symptom. We have brochures just outside the back door telling you more about our program, and on the very front of the brochure, it just goes through a list of symptoms that you might have started since 9/11, persistent cough, wheezing, shortness of breath, sinus infections, stomach problems, and certainly the psychological issues that Scotty referenced, depression, nervousness, anxiety, things that are just not going away or have gotten worse since 9/11. And sometimes people just attribute these kinds of health changes 11 years later to aging. But if you have been in an exposed area and these symptoms have been part of your life after 9/11, we would encourage you, it's worth it to you, to come into the program so that you can be assessed and, if need be, treated by the experts in this field. And people are coming in 11 years later. Just like Lori said in the introduction, the number of people who have been enrolled since this governmental process took over the enrollment. And people will continue to come in. And kudos definitely to John. And there's some of his team I see that I saw often in Washington, D.C. when John really was helping to lead the charge. He was the right-hand man for Congresswoman Maloney. Carol Maloney was really instrumental in helping ultimately the legislation to be approved. And for the community survivor program, it was Congressman Nadler partnered right along with her. And certainly other electeds got intimately involved. And ultimately, this bill was passed. But it was because of that footwork, that groundwork, that John and his team and others like him did. And I include, and I respect and thank John for embracing the survivor community to be a part of the legislation because we were at risk of not being included. But ultimately, because of his and others' efforts, we were. So this program is here, and we've been here for years. You might have seen our ads again on the subways, and this year we are also in bus shelters and key immigrant neighborhoods around the city. So we're trying to be visually present to let people know that our program exists, that the World Trade Center Health Program is here for both survivors and responders. Thank you, and we're taking any questions.
Just so everybody knows, who here suffers from post-traumatic? Who's diagnosed? I mean, I was. I'm not afraid to admit it. Post-traumatic's covered under the healthcare part of the bill. You get treatment at the centers of excellence for that, but it's not covered under the comp. And I don't agree with this, but it's not covered under the comp. If you have just post-traumatic, I suggest you get a good lawyer who's going to fight for you when they go in front of Shield. That's all I'm saying. And I'll give you history. Under the first VCF, when Ken Feinberg was running it, I'll use an example. TJ, if you went in front of Ken Feinberg in 2001 and you had respiratory problems, you got $100,000. But if you had just post-traumatic, you got nothing. But if you had respiratory and post-traumatic, you got $150,000. So post-traumatic help your other illnesses. So if you do have post-traumatic and you have other illnesses, you'll be okay. But if you have just post-traumatic by itself, then I highly suggest you go to these centers of excellence and go through these rigorous physicals. Not to say you hope that you find something, but you're just not going to get compensated by just having post-traumatic by itself. And again, I disagree with that because I believe post-traumatic will be the #1 killer of 9/11 responders. And I say that not lightly. I say that because it's physical and mental stress on the individual. And with that stress, it breaks down your immune system. And it does not allow your body to fight the illnesses that you have. And in 2006, the Surgeon General said it was a physical injury. And I think we should take this up with those in charge